So approximately 2 years ago, I want to say about 2 years ago, I just got out of OTS and I got a message through my Instagram asking about OTS. And lo and behold, it was Captain Booleron. And that is the beauty of the Air Force, is it brings people together. What's really good on my day ones? Welcome back to the channel. Here we got with me today.
Hi everyone, I'm Kat.
So
I'm so shy.
I brought her on to my channel only because it's hard for me to give my perspective as a civilian who went into the Air Force, but to have more feedback from someone who's done it herself. And you get to see two sides, because you get to see a side where you see me, I'm like always excited to share stuff with you, but then you'll get to see a different side of what her politics is like, what she's going through, and what she might want to do with her career. I want you to go ahead and talk about your nursing background and tell us how it was from your transition to civilian to military.
I reached out to Santos exactly around 2 years ago this date, or this month, and I told him that I'm about to go to OTS in like 3-4 months. I stumbled upon him, I'm sure the same way the rest of you guys are finding Santos, and that's through YouTube. That's how I figured out his Instagram handle, and I asked him a bunch of questions about what to expect at OTS, how can I better prepare myself, and what nursing is like in the Air Force. Backtracking, when I applied to the Air Force, I applied with about 6-ish years bedside experience in the civilian side. I worked in an adult oncology ICU. Because of that experience, I was able to come in as a first LT. I reached out to a healthcare recruiter, Master Sergeant Matthew Davis, and he was able to get my package rolling. And honestly, before I knew it, 2 interviews later, I was going to OTS early April of 2 years ago, I guess. No, wait. Well, when did we talk again? 2021?
21, but I think it was approximately, I want to say a year and 10 months ago.
Yeah, because I've only been in the Air Force for, I think, a little over a year. OTS is definitely not what I was expecting, in a good way, because it teaches you, you know, leadership, teamwork. You get to meet a bunch of cool people, and you know, 9 weeks, they really fill you up with, you know, studying, education, physical fitness, doing these obstacle courses. And after that, once you're done with OTS, you go right to the hospital. I thought what I expected was just like civilian, after you're done with your 1 week, 2 week orientation, you were gonna already take patient care load. That wasn't the case. When you are finished with OTS and you start at the hospital, you do a lot of training still, a lot of online training, right? Would you say that's true?
Yeah, and with the military, like it took me like 1 month in process.
Yeah.
Whereas
in process.
Whereas on the civilian side, it'll take you a day. So like the whole month, I wouldn't say it was all dilly-dallying, because it wasn't. It was just more like running all over the place like a chicken with your head cut off.
Right.
Because you just don't know where things are. It's a brand new system.
Right.
And the system for some people like can be, it can be cumbersome. And it's like one of those things. It's like, did I make the right choice? Where I'm gonna have her talk about like what she's experiencing right now in the Air Force, and then also talk about like, you know, her plans with Air Force. So
it's different in a sense where, you know, I came in thinking I was just gonna do a lot of nursing, a lot of patient care, but what I realize is it involves a lot of the rank that you wear. Mm-hmm. You know, you come in as a first LT and you're given these leadership opportunities, and you know, you're trained to be an officer. But still, you know, someone who's been a nurse for, what, 6-7-ish years, you still want to keep up with your skills. You still want to perform well at the bedside. But also on the side, you have additional duties that you have to keep up with too.
Yeah, and just to give you guys kind of like an idea of what my additional duties are that she's talking about, I was on PICU prior to transitioning to my new role right now, they literally pulled me from the bedside to go work at the business operation division, which is possibly one of the highest positions regarding like admin. I get to oversee the operational division side of the hospital, and I get to see the figures. I get to speak with these big figureheads, and at one point I was inside of a room with full birds, and I was like, what am I doing here? And like my rank was a captain. And like, you know, you're sitting here and they're like these 06s and you're like, oh my gosh, like you're hearing all these things I'm pretty sure you're not supposed to be hearing as a captain, but I was hearing them anyway. So now that you're seeing this operational side, you're just like, wait a second, I see what's going on. It's definitely an organization, but like operationally wise, you are being primed to be an officer to lead people. So that's what it really is, because at the end of the day, you're an airman first, a nurse second. That's the thing. I think that's the connotation that people don't understand, is when you come into the military, you will see rank. That's just how it is. Kat can no longer play the I'm dumb card because she pinned captain. Me, I couldn't play it at all. So it's like I came in with rank. Her, she had like, you know, a little bit of a leeway to kind of try to learn the system real quick, because within that lieutenant rank, you know, you're expected to, it's kind of like a crawl, walk, run. So now she's running within a time span of less than a year.
Right, right. I would say, so when I was civilian, you know, I worked a lot at the bedside. I was also a rapid response nurse at my previous hospital. But here, I was never a charge nurse on the civilian side. But here in the military, you are expected to take on more leadership roles. So I did pick up becoming a charge nurse over at the MTF that I'm at. And then also I picked up small little troop, someone to, I guess, guide, watch over, write some OPRs for, and help him get his footing, right, in the door.
But what we will say is this primes you for the time you leave the military. And I keep saying that because let's say Kat doesn't do the whole 20. She just does 4 and goes reserves. She will have broken the glass ceiling that exists for people like us. And believe it or not, there's a glass ceiling that does exist. And I say this for people of color, it does exist. But should she leave, she would have broken that every glass ceiling, and she will have every job offer possible to her. So that's one thing to keep in mind, is like you break those barriers, and that's what we're doing. The things that you were doing, you know, a year ago at your own old home station or your old hospital isn't the same things you're doing now.
Right. So I was actually going to mention that, man, the training that you get in civilian and the training that you get in the military is, it's a whole new world. Like the stuff we've been doing this week. I don't want to give it all away, but the simulations we get to do, our flight that we got to do the other day.
Yeah. There's just some things that you will not experience on the civilian side that you experience here.
Right.
And when you know, 10 years from today, you look back and you're like, that was fucking awesome. For you, what are your plans with the Air Force, or what are your next 5 year? What's your next 5-year plan? There you go.
I've always been a diehard bedside. I love taking care of patients. I love being at the bedside. I love keeping up my skills. And the Air Force gives you a lot of avenues to go back to school, to become a CRNA or an NP. But to be honest, Santos, God, I only see myself doing bedside. So for right now, what I'm doing is I'm working ODE. I've been working ODE for actually over 6 months now. So I've been able to try to juggle this full-time Air Force job with a per diem civilian job. So one, I could still keep up my skills, because I miss the acuity of what a civilian hospital brings you. I miss how, is crazy the word? I don't know, or busy, or
I want to say,
how do I describe
being busy? Like, I guess you want to say, I don't know how to describe that. So there's a difference.
You know what I mean? When you are working civilian and you're in a MTF, like the acuity is different. It's definitely, I think, higher.
Yeah, acuity
in the civilian side.
So here's the thing: is she's from another medical training facility, and I'm from another medical training facility. We're not gonna say the names because people are crazy on the internet. Like her medical training facility does not have the same acuity as mine. Mine is just non-stop. And we're the #1 trauma center in the country. Not #1 trauma center, #1 Department of Defense trauma center in the country. She's the #1 Air Force.
Yes, that's like the #1 Air Force hospital.
The #1 Air Force hospital, but that says a lot. If her acuity isn't up to par to the #1 DOD, that just means that they have room to like ramp up. But you know, that's in the pipeline of discussion with like upper echelon. But for her, she's not having the same experience as me, which it depends on your MTF. So I guess that's just one thing. So
well, also, you know, us both having ICU background is kind of what led us to be here this week and meet this week after you know, talking, texting for over a year now. And
and
I want to talk about like CCAT, like kind of how we got here.
Okay. So we're segueing from the main discussion that we're having. And this is going to be like hopefully this isn't like a 30-minute video, but it's going to be a very informational video. We're talking about something called CCAT, and this is an opportunity that all ICU nurses get to go into. However, it's like one of those things, you have to really assess yourself as an ICU nurse and where you stand in your practice, because you need to be a strong ICU nurse. And I'm not saying that everyone who goes through this course is strong. However, building situational awareness, building the mandatory skills at the bedside, building just the overall, what's that word? The overall team dynamics at the bedside. You could only get that at the bedside. And those are the things that you hone in on. And that's what we're doing right now, is we're at a course called CCAT in Cincinnati.
I don't want to give much away, but so CCAT is a 2-part course. You go to initial, and then you go to advanced right after, or maybe a few months after. And they pretty much teach you or shape you into becoming an ICU nurse in the plane, in the back of a plane.
It's just a different experience. Oh my gosh.
Yeah, I don't have, you know, hopefully, crossing our fingers, we both pass next week, but for those who are already CCAT nurses that we know, the experiences that they've told us about definitely is motivating, inspiring, and it really drives us to want to be here and complete the course and pass. But they get to bring home, you know, our military brothers and sisters.
And it's crazy too, because like a lot of the ones that we are going to see, or the ones who have gone through CCAT already and who have applied to school, they have gotten like, I'm not going to CRNA. I don't know what she's going to do. But like the ones who get the CCAT identifier end up doing big things in the military. And for the ones who have applied to CRNA, I swear, everyone who I know who has applied with a CCAT identifier, 0% have not gotten in. 100% have. So that speaks volumes. So it's like it's a nationally accredited program, and we're working with UC to get basically our validation accreditation for this special identifier, and it's just something for you to look forward to, I believe. So
I get this question a lot. Mm-hmm. Like, for example, from my previous recruiter, like, what would one have to do to try to get in this position? Do you have any tips from your experience at your MTF to try to get this slot?
There are, I want to say, a total of 4 major MTFs as Air Force that we could go to. Walter Reed, BAMC, Florida, Nellis, I want to say Nellis and Travis, 5, not 4. So out of all those hospitals, they are either level trauma 2 or trauma 1. Get yourself to a facility that could offer you a high acuity. The highest acuity ones that we have, actually, Walter Reed, BAMC, just those 2 is my understanding. But the other 2, I'm not discrediting them in any way, but you heard her MTF isn't as high acuity, so she has to pick up shifts on the outside. I would say get a solid 1 to 2 years of ICU experience. Get to know your vasoactive drugs, and if you want to go this route, the moment you sit down with your chief nurse, you let them know that this is what I want. And I don't know what I want 10 years from now, but I know within 5 years I want to go to CCAT. Again, it's just like one of those things, once you get it under your belt, like you are literally the alpha. We're starting, our numbers are going down, they're trying to increase it, but it's hard to get people into the military, so.
When I became interested in the Air Force, I did a lot of research, and I did see that there was something called CCAT, and I was very curious to know what it was about. And when I realized that it was ICU flight nursing up in those awesome, cool, like Air Force planes, I was hooked. One of the first thing I did when I hit my MTF was I reached out to, leadership, and I let them know that I was interested. It took me about like less than a year to get my foot in the door and, prove that, I can handle patient care. And also working ODE honestly helps a lot, because you have to keep up your skills, really think, ahead and advocate for your patients. And I feel like, they see that and, they'll push you forward into trying to get you a spot.
Yeah, absolutely.
That's what happened.
With the Air Force, let's say you do get out,
okay.
Let's say you do get out, enjoy it. What do you plan on doing with your experience that you accrue here?
I wish I could give you a solid answer, but I really think it just all depends on, next Friday when we finish this CCAT course, don't you think?
Yeah, it's crazy too. And take this with a grain of salt, is the military, one day you want to get out, but then all of a sudden something changes and you're like, oh damn, I don't want to get out. So you're in this mindset of like, I want to go reserves, but then something else comes up where it's like, are you sure you want to get out? Here's all this experience. And then all of a sudden you get a 2-year pay bump and you're like, I don't know if I want to get out. Because now you're making more money than your civilian counterpart. Well, if you're in California, that's a totally different thing. But I would not, for one, pick up like shifts on the outside in Texas. Absolutely not. But if I was in California, I would. So that's a totally different thing. So again, you gotta set goals for yourself. And she already knows how I am. Is like, I don't live week to week, month to month. I live day to day. And she'll ask me like, are you gonna study? And it's like, I don't know if I'm gonna study. You could ask any one of my workers or co-workers at my MTF. It's like, oh, what's your schedule next week? I don't know. I only know my schedule for this week. Don't ask me. It's because I don't like anxiety, and I don't like to cause unwanted anxiety. So, What advice do you have for future airmen coming into the Air Force, and what would you have basically done differently coming in to the Air Force? Like, well, what do you want to tell them?
Honestly, I don't regret the route that I took, because I know there are multiple ways to become an ICU nurse in the Air Force and be Air Force trained into it. But I'm really grateful for the civilian experience that I got coming into the Air Force. And I felt like, coming in with what my previous civilian hospital has taught me made me a much stronger nurse. And wearing my rank proudly because of the experience that I had on the outside. I recommend everyone, if you have that thought that's just itching in the back of your mind, like, what would it be like? Just go for it, because that's exactly what I did.
And you could ask anyone who's ever joined the Air Force, like, they've always had that thought of, I want to serve, I want to do it. Like, if you skip that thought process and you go on to do the next thing in the civilian life, but you're doing the same thing day in, day out, that thought will always be there.
Right. Just bite the bullet.
Yeah, so you bite the bullet. It may not be what you expect it to be, but at least you
did it.
You checked it.
Tried, yeah.
But then what will happen is you leave the service knowing that like you served. And don't be like some people who come in and they're just like super angry about like their decision. It's like, no, man, take the opportunities that the Air Force are going to give you, educational opportunities, leadership opportunities, TDY opportunities. I mean, like where we're at right now in Cincinnati, it's all paid for from the Air Force. But like, how we see it is like it's a paid vacation because we're here to learn, and then something comes from it. So there's that incentive of like, you're gonna do something bigger. They're gonna use you for something bigger. And it's always a part of like the bigger picture, because granted, something pops off. I guarantee you the markets for going into the Air Force, the Navy, the Marines, the Army is gonna be so flooded that even for us, like should something pop off, we're not leaving service. Like, we're gonna be probably teaching people all these skills that they need for this upcoming war. Okay, you can hear that from me.
You know, I think the benefits and what's made me grateful about joining the Air Force is, one, the people that I've met, like the connections that I've made, and the TDYs. Like, being able for the Air Force to send you to different parts of the country to learn things, train, I can't trade that with what I was doing in the civilian. You don't get that out there, so.
And like the valor it comes with, like,
yeah,
it's just one of those things. It's like, you know, America's so grateful for their service. I'm grateful for everyone who's served and everyone who's serving with me, and just the people that you will meet, because like I wouldn't have ever met her if it wasn't for the Air Force, and how small the community is. Like, the fact that you'll be on a TDY with someone who knows that other person, is just this big web of like people.
Yeah,
like,
the medical community is
small. Like, it's small.
You know people, right?
And like just the networking opportunities. It's just one of the most amazing things I've ever seen. Granted, the systems kind of suck, but like you learn to work with what you have, and the more that you embrace it for what it is, like, you know, I feel like it does get better. My motivational spiel is, if you are wanting to try something, especially the Air Force, maybe the Navy, Army, I don't know. Like, for me, it's like my thought process is like, why would you join the Marines? But I guess it's like a different kind of valor, you know, like, do the hardest thing. Do you really want to do the hardest thing? But like, if you have that thought process and you really want to go through with it. And this is why we make these videos, is because I noticed that there was a disparity of it online. No one was doing it, and I feel like the more that we could help people acclimate to this organization, and the more that we could create a more welcoming climate of leadership, the Air Force will get better, and you grow where you're planted, and that's the most important thing, is knowing where you are in your place in the Air Force and going from there. Because yes, I might not be at the MTF I wanted to be at, however, I'm making the best of it. And every time I get a new accession or someone who I know is going to the same military medical training facility that my friends are at, I will always push them forward. And create that network to make sure that it's like, hey, there's a community out here that I'm building. There's a community out here I'm building. There will always be someone there to help be receptive and help you get to where you need to be. So
yeah, and sorry to interrupt, but it's a small world, because you did that for me. You hooked me up with, the people that are my closest friends now, and then you did that for someone else, and now he's actually my troop. So it's literally a small world. If
you guys were to see my inbox right now, it's starting to become cumbersome. That's why I'm pushing them forward, so I can create that network so that they could be helped, if that makes sense. Because like, I can't do this alone, but with that community of like airmen who are willing to help me. And you could ask anyone, like, how I am on camera is how I am in person. So I will do my best to always push you forward to the people that you need to be at. But if I'm ever a dick and you run into me, it's just because I'm busy. Just understand that. And like, probably leadership is barking down my throat. So besides that, any last words?
No, you guys, I'll see you on the inside.
Yeah, so like, if you are needing some mentorship and you do need people to talk to, reach out to us. All our links will be down below. Her links will be down below. I mean, she disabled her Instagram just for this week, and it's funny too. Like, that'll be a different story. It's like, I don't study as hard as I should be, and then you see everyone else around me studying hard. I'm like, why is everyone studying so hard? But like, I guess that's like, I don't know. It's just, this is how I am. And
I'll see you guys next Friday.
So you guys take care. And we'll see you guys next video. You might not see her, but you'll see me. And yeah, new video coming out soon regarding OTS, because OTS went to 2 weeks. And I have the person that she's mentoring, that I mentored, he's gonna be on the video, and we're gonna talk about it, and we'll talk about that 2-week OTS experience.
Bye, guys.
Y'all take care. Bye.
Can you add the bloopers?
Yeah. That's good right there.
Nervous.
Ready? Hold on, let me put my shit together. So.
Okay, let me try, okay. All right,
here we go. So approximately a year ago, no, fuck, hold on.